Okay, there we go. Thank you. Okay, great. So I would like to begin this presentation with a land acknowledgement. I'm joining this call today from my home located on the traditional territory of the Klaytene First Nation, part of the Dekel Carrier Peoples Territory. I recently moved to Prince George from Lekwungen, Songhees and Esquimalt Peoples Territory, where my family lives in Victoria, BC. And I'd also like to acknowledge that the research I'm presenting today did take place across the province of British Columbia. And I'm just sharing a photo here of the circle of cedars, which I took when I walked the ancient forest trail in Chunto Woodjude Park, located in the traditional territory of the Klaytene. Okay, so here's just a brief overview of what I'll be presenting today. I will start with an introduction to the medicine bundle pilot and study objectives. I will then move into the research methods and provide an overview of the results and key discussion points, and then we'll wrap up with the conclusion and some next steps as well. Okay, so starting with the introduction and objectives. The Medicine Bundle is a project run by the Community-Based Research Center's Two-Spirit program. The Two-Spirit program develops programs and initiatives that enhance the health and well-being of Canada's Two-Spirit and Indigenous, queer, and trans communities. The Community-Based Research Centre operates across Canada. And during the pilot period of the Medicine Bundle, I was hired by the Two-Spirit program as a trusted messenger. And a team of trusted messengers was hired to promote and distribute medicine bundles to Indigenous community members across BC. All trusted messengers identified as Indigenous people. And I'll briefly introduce myself here. So I have mixed Coast Salish and European ancestry. My maternal grandmother grew up on Gabriola Island, which is not too far from where I grew up on Vancouver Island. And I am a straight cisgender woman. I'm very grateful for the opportunity to work with this project. And I came to the project while I was completing my master's in public health at the University of Victoria. And then this became central to my thesis. And I'm a new student at UNBC now in the PhD Health Sciences program. And I look forward to continuing my relationship with the Two-Spirit program team. Okay, so here I have an image of a medicine bundle, which I'll walk through in just a moment. I'll just introduce the project first. So the Medicine Bundle pilot is rooted in community-based initiatives to address the public health issue of HIV and other sexually transmitted and bloodborne infections, or STBBIs, in Indigenous communities across Turtle Island. But the pilot did focus on experiences within BC specifically. And following my role as a trusted messenger with the project, I evaluated data collected from the pilot. Yeah, the project is completely rooted in community identified needs. And then looking at the photo here, the medicine bundles included traditional Indigenous medicines such as cedar, tobacco, sage, a smudge bowl, tea, devil's club salve, and bear grease. And then coupled with Western sexual health resources, including lube, condoms, and an HIV self-test kit, and or a dried blood spot collection kit. And participants could self-select the medicines and the self-test kit that they wanted included in their bundle. Okay, so Lane Boners from the Two-Spirit program shared this quote when speaking about the medicine bundle, and I wanted to share that with you today. So Lane said, this medicine bundle will explore the uptake of Indigenous designed, peer-led, and culturally competent approaches to sexual health through HIV self-testing and dried blood spot testing, creating opportunities that not only position Indigenous people as the ones accessing resources, but as providers, uplifts and strengthens community. As Indigenous people, we have the knowledge and relationships in our own communities to provide sexual health guidance and support in ways that cannot be achieved by those without those same connections. So the primary objective of the Medicine Bundle pilot is to increase access to culturally safe approaches to HIV and STBBI health for Indigenous people in BC. This research aims to establish that Indigenous-led health initiatives are wanted and more effective for Indigenous communities than non-Indigenous initiatives. So my work on the project addressed the following two research goals. First, to assess the effectiveness of the Medicine Bundle pilot as an Indigenous and peer-led, community-based, and culturally safe HIV testing service in BC. And then second, to evaluate barriers and access limitations to sexual health resources for Indigenous people, especially Two-Spirit, queer, and trans Indigenous folks in BC. So literature for the background and significance of this project focused on these kind of key areas here. So the social determinants of health, the determinants of Indigenous health, the importance of self-determination and sovereignty, as well as cultural continuity in health programs, the existing gap in services due to differences between Western and Indigenous perspectives of health and approaches to sexual health, and then concluding with some solutions to bridge those gaps. So now I'll move into some of the methods and methodologies used, including protocol. So the Medicine Bundle uses community-based research, mixed methods analysis, and decolonizing and Indigenous research methodologies. This is a community-based research initiative where the project was driven by community needs and community members were involved in all stages of the project. A mixed methods research approach was used to evaluate the pilot data, including both quantitative and qualitative analyses of survey results. And decolonizing and Indigenous research methodologies center Indigenous worldviews, knowledge systems, and voices, and create space for researchers and community members to build lasting collaborative relationships. The Medicine Bundle pilot uses a two-eyed seeing approach to sexual health, combining traditional Indigenous medicines with Western sexual health resources. And some aspects of Indigenous story work were also incorporated, which is a methodology which values storytelling to understand and share knowledge. So now I'll move into the study results and some key discussion points. So looking at a high-level overview of the demographic information on the pilot program participants, most participants, 69%, identified as First Nations, while 33% identified as Métis. Only 2% identified as Inuit, which is an identified gap in the research of the bundle pilot, because the 2021 census found that just over 1,720 people living in BC identify as Inuit. The average age of participants was 34 years old. And I will note here that the Medicine Bundle for the pilot, it was only available to adults over the age of 18 years. For gender identity, 49% of participants identified as women, 28% as non-binary, 26% as transgender, and 19% as men. And for sexual orientation, 39% identified as bisexual, 34% queer, 27% as indigiqueer, and 23% as pansexual. So while qualitative data were limited in this study, analysis of the written answers provided through surveys identified the following key themes of participant feedback on the Medicine Bundle. So first we had cultural connection, which is connection to the Indigenous and or Two-Spirit community, as well as connection to self as an Indigenous person. Sacred medicines is the second one. So sacred intentions in the creation of the Medicine Bundle and acknowledgement of the sacred medicines included in the bundle and their uses and benefits. And then third, we have better experiences. Participants reported having a better experience with testing through the Medicine Bundle, feeling safer and more comfortable at home, and finding the self-test process better than Western clinical options. And here are some quotations from participants reflecting on their experience with the Medicine Bundle. So the Medicine Bundle made me feel connected as an urban Indigenous person. I love that I was finally able to access some traditional medicines with such sacred intentions. And I think this project is amazing. Having simple, easy access to testing in my home, my safer space, was great. I could smudge or use the traditional medicines after self-testing, which made it feel like a much better experience than others I've had in clinical spaces. Participant surveys, along with healthcare worker and community consultations, which were completed by the Two-Spirit program team, identified existing gaps in services available to or designed for Indigenous people. To understand barriers and access limitations to sexual health resources for Indigenous people in BC, several questions from the Medicine Bundle survey were used. So we found that nearly half, 47% of participants reported that they were tested for HIV more than 1 year ago, and 1 in 5, 21%, had never been tested for HIV. And just for context, it is recommended that adults be tested for HIV once, and that people who have had more than one sexual partner since their last HIV test should be tested once per year. And that's from the CDC. When asked about their experiences accessing sexual health care in their community, almost half, 44% of participants said that accessing care in their community was somewhat easy, while 30% said it was somewhat difficult. 39% of participants reported having ever left their community to access sexual health care. All participants who completed the post-bundle survey reported a good overall experience with the pilot. 88% reported it was very good, and the remaining 12% reported that it was good. 91% of participants reported that having access to traditional medicines was a benefit of the Medicine Bundle pilot, and this was the most reported benefit of the program. Just over half, 55% of participants indicated that their experience getting tested through the Medicine Bundle pilot was much better than other testing experiences. And an additional 21% reported that their experience was somewhat better than other testing experiences. From these results, we can conclude that Indigenous-led approaches to sexual health are more effective and better received in Indigenous communities compared to Western approaches. And here I'll go over some strengths and limitations of the project. The Medicine Bundle pilot uses a strengths-based approach to develop a sexual health initiative prioritizing self-determination in health. The mixed methods approach in the analysis allowed for a holistic understanding of the pilot data. Limitations included limited qualitative data available. The trusted messengers were limited in how far they could travel, therefore limiting the reach of the program. Additionally, the 3-month timeline of the pilot program limited the capacity for relationship building with community members. Lastly, the inclusion criteria required that participants be a minimum age of 18 years, and the program therefore could not reach youth. And as mentioned, we had few Inuit community members who were reached through the program, which is a gap to be addressed in future iterations. Okay, and in conclusion, Indigenous-led approaches to HIV and STBBI health, such as the Medicine Bundle pilot, prioritize self-determination, cultural continuity, sovereignty, and Indigenous-led research. Indigenous communities in BC deserve culturally specific approaches to HIV research and policy that are holistic, inclusive, and center Indigenous knowledges through integrative science frameworks, combining both Western and Indigenous ways of knowing. Indigenous worldviews and experiences are unique to each culture and must be understood individually. The results presented today demonstrate that the Medicine Bundle pilot is a successful intervention for Two-Spirit and queer Indigenous people based on successful dissemination throughout BC and positive participant feedback. And I'm happy to share as well that the Medicine Bundle is now operating across Canada, having received funding to expand beyond the pilot project. And the Two-Spirit program team has developed a community handout on the project, which is available on the CBRC website, and I'm happy to drop that one in the chat. And that is it for me, so thank you.
Thank you, Emma, so much for sharing. Very interesting project. Just want to give an opportunity for anybody in our audience, if they have any questions for Emma. And I do see one here from Stephanie. And so she was just curious about if there's going to be something specific to youth, maybe a pilot in the future for that group.
Oh, that's a great question, Stephanie. I'm not aware of a youth-specific pilot coming forward, but as the bundle is being expanded across Canada right now, I think there will be some more work to engage a little bit more specifically with communities going forward and seeing what their needs are. And so I think there might be opportunities there to find ways to reach you. So thank you for asking. Oh, I see another question here.
Yeah, from Victoria.
Thank you.
And so she was just wondering about some maybe next steps that you see.
Yeah, sure. Thanks, Victoria. Yeah, I think next steps will be engaging with specific communities and trying to develop more specific iterations of the medicine bundle that will be informed by communities. So with the pilot project, we had kind of those different options that I shared with the image in the beginning there, and people could select what they wanted. But going forward, we'll be doing a little bit more work with communities to see what items they would like included in their bundle, and then they can be more culturally specific and with the medicines as well as the sexual health resources. So yeah, thanks.
Wonderful. Thanks again, Emma, for your presentation. And then now we'll just pivot to our final presenter. So Victoria Bleeker from Saving Lives with Pride is going to be presenting on engaging sexual and gender minority communities in stem cell donation. So I'll turn it over to you, Victoria.
Hello, everyone. Thank you so much for joining this morning. I'm just going to share my screen. Can everyone see the non-presenter view of this presentation?
Right now we're seeing your notes, but in the before you hit the button, we were just seeing the
Okay.
slides. Yeah,
Okay, give me one moment here.
sure.
Okay.
There we go. We just see your slides.
Excellent. That's
Oh.
great.
Oh, I think it reverted again now. I just see
Oh,
notes.
sugar. Okay,
Oh, there. There we go.
go. I'm just trying to figure out how to pull up my notes here. 1 second. Oh, that didn't work. So sorry, everyone. Give me 1 moment.
Do we still have you there, Victoria?
Yes, I'm just trying to figure out how to get my notes pulled up on a separate device. Give me 1 second. I'm so sorry.
Sure.
Okay, can everyone see my slides?
Yeah, perfect. Looks great.
Yes. Okay, thank you so much. Apologies for the minor technical difficulty there. Hello, everyone. My name is Victoria Bleeker, and I am the campaign lead for Saving Lives with Pride. I am also a medical student at the University of British Columbia at the beautiful Northern Medical Program campus. I am delighted to be speaking with you today about our work to engage sexual and gender minorities to stem cell donation. I am grateful to Dr. Warren Fingroot, Director of Saving Lives with Pride, for his mentorship on this project. I would also like to thank my co-authors for their contributions. I would like to acknowledge the privilege that I have to speak with you all on these traditional territories, the Clay Lake Tenay Nation, where this project was conducted, as well as the Saikoots First Nation, where I am presenting from today. So, a little bit on stem cell donation. Stem cell donation is a potentially life-saving treatment for patients with blood and bone marrow disorders. To join the stem cell registry, all it takes is completing an online form and a cheek swab. Unfortunately, for many patients, especially those from non-European backgrounds, they may struggle to find a matching donor in registries, both in Canada and globally. These challenges emphasize the need to raise awareness and encourage registration in underrepresented communities. So, although there is a need for diverse donors, prior work has highlighted specific populations that face unique barriers. So, in terms of the barriers for LGBTQ individuals, there are three main ones that were identified. The first is that there's a lack of awareness about eligibility. Many LGBTQ individuals are not aware that they can register due to historical and ongoing exclusion within the LGBTQ community. There's also stigma and a fear of discrimination. So past exclusion can foster mistrust and create anxiety about coming out or facing judgment in the healthcare settings. In northern and rural populations, there are additional challenges, including limited access to donation centers, lower exposure to education and awareness campaign, and when LGBTQ individuals live in northern and rural areas, such as Prince George, these barriers intersect and compound, making registration even less accessible. So, I'd like to tell you a little bit more about Saving Lives with Pride. Saving Lives with Pride was launched in 2023 and aims to break down barriers that prevent LGBTQ individuals from becoming donors across blood, stem cell, organ, and tissue products. This initiative runs an annual campaign to increase LGBTQ engagement in stem cell donation and works towards a more inclusive transfusion and transplantation system for patients, donors, and their families. Led by LGBTQ advocates, we collaborate closely with community partners to advance equity and representation in donation. In 2024, we took a big step, expanding from only large urban centers to our first northern and rural event in Prince George. So my objective for today is to evaluate the 2025 Saving Lives with Pride campaign and the recruitment in northern and rural contexts. So we set out to run a national campaign to engage young LGBTQ adults across Canada and the US. Before I talk about these donor recruitment events, I'd like to address how we designed our campaign this year. So how did we build the campaign? In January of this year, we published an analysis in Lancet Hematology, and we had previously published multimedia resources highlighting LGBTQ diverse performers from sexual and gender minority populations across Canada, including donors, patients, drag queens, and community advocates to cover the key educational topics in donation, including that sexual and gender minority populations are eligible to donate stem cells. In the Lancet article, focus groups of sexual and gender minority populations were conducted to gain their perspective on these resources, resulting in the generation of recommendations that were used to build this year's campaign. I will now review how we applied the recommendations to enhance the 2025 Saving Lives with Pride campaign. So we provided clearly outlined campaign purpose within our materials, as well as relaying this information onto our volunteers. So the purpose of our campaign included the main focus on engaging LGBTQ people who may not know that they are eligible to be stem cell donors. Our Our campaign was not only active during Pride Month, which holds special significance for the LGBTQ community, but also year-round. And we made sure we were very careful to not equate HIV status with health status, and our infographics, including the one shown on the right, sensitively and without stigma, address theoretical concerns if someone with HIV donated stem cells to a patient who is immunocompromised. Next, we avoided using population labels that excluded subsets of the community that the campaign seeks to engage. So in our campaign, we seek to recruit all LGBTQ people rather than focusing on a specific subgroup such as bisexual people, trans individuals, or men who have sex with men. In this way, we engage all donors and we make sure that no one feels excluded. This language was reflected in the language used by volunteers as well as in the infographic material. We also emphasize that sexual and gender minority populations are not only eligible, but they're wanted and needed as donors. And this was made clear through the language, once again, used by our volunteers and campaign leads, as well as through posters, such as the one you see on the right. These visuals help to portray the need for LGBTQ donors in a simple, uplifting, and powerful way. So, we also deployed multimedia resources specifically focused on addressing sexual and gender minority populations, including those with intersectional identities. We featured people from a range of gender identities, sexual orientations from sexual and gender minority populations. Saving Lives with Pride has curated several multimedia resources that are available both on our website and our Instagram. I now want to highlight some of the multimedia resources that were created and helped to inform our campaign. So this story that I'm about to show you is by Justin Saint. He's a resident of Vancouver, and he's also a makeup artist and performer who is an advocate for Saving Lives with Pride. I won't have time to show you the whole video, but I think it's a really beautiful TikTok.
Back when I was a university student, I discovered that I wasn't able to donate blood because of who I was dating. I was part of a student club that organized campus blood drives, but then I got a boyfriend and things went well in the bedroom, which meant I had to stop participating in my own campus blood drives. My fellow students and I were baffled by the rules banning sexually active gay, bisexual, and some trans men from donating blood. So when I heard about the Saving Lives with Pride campaign, which encourages men who have sex with men to donate their stem cells, I was really happy to share my story. For many years.
So that's Justin's story. I do encourage you all to go and listen to more of that video, but in the interest of time, I'll keep going. So we also featured LGBTQ advocates, including those working in healthcare and personally affected by healthcare. This is the story of Joel Coette, who is a nurse who actually was diagnosed with leukemia, who is an advocate for our campaign. We also reassured sexual and gender minority individuals that they will be treated with respect by their healthcare teams. We have transplant hematologists across Canada, including Dr. Arjun Law and Dr. David Allen, that have come together with this campaign to highlight the heroism of LGBTQ individuals. We engage LGBTQ individuals to healthcare, so volunteers were trained to address and acknowledge the history in blood spaces, including that more individuals can donate now, but more work needs to be done in the future. I now want to explain to you how we ran our drives. So each event had similar workflow in terms of planning. We reached out to local champions interested in building a team, recruited volunteers from universities, and volunteers received inclusive training practices from Canadian Blood Services and Saving Lives with Pride. The local teams wore sexual and gender minority inclusive t-shirts, displayed inclusive signage, and were trained in personal stories from the members of the LGBTQ community. And at drives, they explained donor eligibility, that you need to be between 17 and 35, in good general health, and have a willingness to donate. And following each event, the champions reported back their number of donors registered. So what were the results? Overall, we led 20 drives led by 18 champions and recruited 1,271 donors. Most were in Toronto, followed by Calgary, and then Vancouver. And I really want to highlight the Prince George event because this is the one I was at. There's a picture of me there. We had a vendor spot at the Northern BC Queer Connections Pride Picnic on July 6th. Volunteers were recruited from the UNBC Stem Cell Club and Pre-Med Students Association. And they were split into two groups, a recruitment group and a registration group. So one group was responsible for recruitment and handing out infographics and communicating with LGBTQ individuals and answering any questions they may have. And the rest were involved in registration, assisting people through the online registration process and swabbing. And compared to 2024, there was actually an 140% increase from 15 to 36. So, and we use a similar setup and approach. So in order to probe deeper into this, we wanted to gain some volunteer perspectives, and we asked the following 3 questions to each volunteer. So what was found from these 3 questions? We found that there was highlighted grassroots engagement, inclusive messaging, community outreach, social media to mobilize volunteers was another important concept, and partnership with Northern and sexual gender minority communities. So one volunteer told us about the active reception of the Northern SGM community for this initiative. They noted that potential donors responded well to the inclusive messaging and the importance of this initiative for Northern communities and being able to donate in this way for LGBTQ people. Another volunteer really drew attention to the social media aspect for recruiting volunteers and for the initiative, and highlighted the impact of the campaign on the community. And finally, this volunteer really expressed their enthusiasm in the campaign, and I think it's this enthusiasm that was really critical for our success. So in conclusion, this community-led inclusive initiative helped to enhance donor diversity through addressing gaps in donation. We did this by implementing the recommendations of the Lancet papers, and it's really important to consider intersecting identities for LGBTQ individuals when determining barriers to donation. And given the success of this event and the impact on the Prince George community, we would like to continue to expand our outreach. We would also like to expand our outreach in northern and rural communities, as well as partner with rural organizations to apply this model to other healthcare initiatives other than stem cell donation. Thank you so much for your time.
Thank you so much, Victoria, for sharing this important work. And it was great to see pictures, from Prince George's picnic and your table there. Unfortunately, we're out of time for questions, but definitely I encourage people to connect with Victoria through FeedLoop if there's any questions that you had that you weren't able to ask. And just in general, a big thank you to Stephanie, Emma, and Victoria for presenting on all of these interesting pieces of work. Lots of thanks and congratulations from all of us as attendees. And please go back into his FeedLoop and join the next set of concurrent sessions that'll start at 11:05. Thanks again. And if Emma's still on the call, it looks like with me losing power, Emma, you became the host. I was wondering if you could, it looks like you might be recording. If you could stop the recording and end the meeting for all of us. I'm so sorry about that.
No, that's totally fine. Okay, stop recording. Let's see. Oh, it's not doing anything.